Thank you so much for joining us today. I appreciate everybody who's come on this call. I'm going to kick off this press brief by thanking the guests that have come on here today. The folks that have come on here are not here to endorse any political campaign. They're here to just talk about what's happening in our district and what they see as needs on the ground where they work and where they have their fingers on the pulse of what's happening in upper and northern Michigan. So I'd first like to introduce Ashley Halliday Schmant. She's the director of the Northwest Michigan Coalition to End Homelessness.
Thanks, Callie. Today, I'd like to start with just rooting us in the problem and how the Northwest Michigan Coalition to End Homelessness sees this. So something fundamental we believe is homelessness is a housing problem, not a people problem. Across northern Michigan, the biggest driver of homelessness is not addiction, mental health, or personal choices or failings. It's that our region simply doesn't have enough places for people to live. When housing is scarce and rents are out of reach, homelessness rises, and that's what we're seeing in our region. A healthy housing market can look like a vacancy rate around 4 to 6%. For example, Grand Traverse County is around 0.9%. Rents have jumped to 20 to 30% since 2019. Some counties have fewer than 10 rental units available at any given time. Tourism, short-term rentals, and our seasonal economy squeeze the market even tighter, shrinking options for year-round residents. In a market this tight, even people working full-time can't keep up. One setback, an injury, a layoff, a medical bill can push a household into homelessness. In places with more available housing, those same disruptions don't have the same impacts. But we know what works here in Northern Michigan, and we've been investing in it for decades. The solution to ending homelessness is housing. And for those experiencing homelessness for the longest amount of time, it's something called permanent supportive housing. Permanent supportive housing provides long-term housing subsidy and supportive services for people experiencing long-term homelessness. When someone finally has a place to live, everything changes. Health improves, recovery becomes possible, families can breathe again, and hope returns. Housing ends homelessness because housing is the foundation for everything else. Communities invest in permanent supportive housing because it reduces emergency service utilization, like jails and hospital costs. It keeps our highest need residents safely housed. It costs far less than emergency response systems, and it reflects national best practices and strong evidence. But today I need to be honest. All of this progress and these programs are at risk. Last week, HUD released new funding requirements, and for the first time ever, 70% of our permanent housing funding, including permanent supportive housing, is no longer guaranteed. Only 30% is protected. And here's what that could look like for Northern Michigan. Even if one permanent supportive housing program is lost, up to 70 households, seniors, veterans, young adults, people with disabilities could be pushed back into homelessness. And there's no local funding source that can replace these federal dollars to scale. These challenges dismantle the very framework that has kept people housed and stable for years. They can push communities back by decades. As director of the Northwest Michigan Coalition to End Homelessness, I feel that this moment is so critical and so serious, and to really highlight that investment in permanent supportive housing is how we protect progress that Northern Michigan has made. Thank you.
Thank you so much. Thank you so much, Ashley, for speaking about this urgent need with our housing. I'd next like to introduce Adam Sari. He's a member of the Bricklayers and Allied Craft Workers, Local 2. He's the incoming president of the Upper Peninsula Regional Labor Federation. Adam, I'll kick it off to you.
Excellent. I'm going to speak on the income part of this. One of the biggest problems that we're having in not only our area, but the United States currently is income inequality. The new Gilded Age has damaged America that I was raised in and the America that I knew. The people that are doing well are doing way better than I've ever seen in my lifetime. And the complete opposite is happening for the rapidly shrinking middle class and the blue-collar working class. Even currently, the rights of 1 million federal workers were recently rescinded with a swipe of a pen. This was the largest union busting event in American history and is among the most shameful by far. Who is going to represent these workers no longer tied to the rules of civil service, but tied to political machines that can fire you for any reason at any time, including your beliefs? Talk about not being able to do better than your parents. This is it. I recently read in an article that said a family in 2025 to be in the middle class, they must make around 100,000 a year at a minimum. A few years ago, this was compensation for hired salaried individuals, and it's now basically barely a living wage in the middle class. The costs of housing are unachievable for the younger individuals, especially in my area, and the wages are low as well, compounding an individual's ability to live here, let alone thrive. The promise of college bringing them into the middle class has failed them as well, with the cost of education and the crippling student debt that hampers the younger students' ability to afford simple necessities, let alone pay off their debt. We also have a real issue that's been brewing for 90 years as well. There's not been a piece of comprehensive pro-union legislation in that time frame. The National Labor Relations Act in 1935 was the last piece of real signed legislation that has helped unions. And it seems like ever since then, we've had a ton of laws that have gone into place that handcuff unions and do nothing really to help the American worker in any real matter. The threats, the intimidation, the forced meetings, and delayed action many times lay out the workers that ask for their federal rights to organize their workplace, and many end up discharged. And the tone is set to never try to do better for yourself, and then that the owners are really the only ones that will decide what the workers will receive. I hear so many people on all sides arguing about their rights that they have. Usually it's nothing set in stone, but some sort of pseudo-enlightenment type thinking that people feel are their rights. But in this case of workplace organized, these are actual rights. They're enshrined in law, but they're seldom enforced. Actually, today, the board that oversees labor cases is currently without a quorum intentionally. Unfair labor practices are not being processed today. Not only that, even if a group chooses to organize with overwhelming support, there's no board quorum to certify that election. The election goes into a union purgatory, and anyone who is in a union campaign is a sitting duck currently, and this must change. This is wrong on every level, and we need comprehensive change. The PRO Act must be brought into law, in my opinion, in the next 4 years, and we must make this a priority for the future of our children. Their ability to bargain wages, insurance, and retirement is not just a fundamental right, it's also a federal law. This being said, when you have areas that are unionized, everyone does better. I agree with the pro-America agenda that creates jobs, cuts red tape, and allows the people of our nation to have a bright future. If we build American, buy American, and we add that pro-union label back to this country like I remember growing up, America prospers. And this isn't a far-off principle, people. When I was a child, it was real. My bikes that I bought were union made in America. The mines that supplied the steel for our UAW-built cars were union and 15 miles away from my house. The previous generation retired comfortably, and to have a lake house is not reserved only for the wealthy. When you have higher union density rates, you have higher wages across the board and benefits. You have less people on government assistance because they want a job that pays well, let's be honest. And they want something that has insurance and has retirement in with it. When your choice is between taking a 35-hour-a-week job at $16 an hour and losing your health coverage, or maybe doing less so that you can keep your health insurance for your family, that's a serious predicament. And we can do better than this, people. Union favorability is around 68%, but only about 9% of Americans personally belong to a union, currently according to a recent Gallup poll. If there's any stat that should show you that the game is rigged against the unions, this should be it. Could you imagine if the presidents got this for voters in an election? 68% of the people? You only need to have 60% of Congress to pass a bill, and 68% of the people that are represented are in favor. So what's the holdup? We need more people in Congress that stand up for the people they represent and less that want to stall, play games, and represent groups outside of their constituencies. We need pro-worker legislation, and we need it now. We're not looking for some garbage rhetoric. We're looking for strong leaders that are willing to actually stand up for working families, not just say they're representing working families and behind the scenes gut all the laws that help working families get a better shot. We need to reshuffle the cards, and I believe changing winds are building momentum for a better pro-union future for families. If we don't have leaders to take this seriously and leaders that decide to represent the will of the majority and the working class people in America, we need to make change for ourselves and for our futures. Let's try to make the PRO Act a priority in this country instead of billionaire tax cuts and regressive laws that do nothing to help the 97% of the people in this country that we could do so much better for. Let's, for the first time in 90 years, change the script for ourselves and for future generations to deserve better than what we've seen in the last 45 plus years of my life.
Thank you so much, Adam. Really appreciate that. It's shocking to think that we haven't had pro-union legislation since 1935. 1935. And we see corresponding income inequality to 100 years ago to where we are now again today. And I'd like to now introduce Kim Atkins. She's the Executive Director of the United Way of Otsego County. Thank you, Kim.
Thank you. Thank you all for being here today. I would like to talk about something that is already having a very real impact on our neighbors, our families, and our community, and it's the cuts to the recent SNAP benefits. In Otsego County, 40% of our residents are in the ALIS population, asset limited, income constraint, and employed, 41% in the state of Michigan. They rely on SNAP to help put food on the table. These are not strangers to us. They're working families, they're seniors on fixed income, people with disabilities, and parents doing everything they can to create a stable life for their children. When SNAP benefits are cut, the effects are immediate and deep. Families have fewer dollars to stretch across rising food costs, and many are forced to choose the cheaper, less nutritious options or skip meals altogether. These cuts just don't affect the individuals. They ripple through our entire community. Food pantries and local charities are already seeing a huge increased demand. Our food pantry locally here is upwards of 50% from last year. The organizations work tirelessly, but we simply cannot replace the scale and consistency of the federal food assistance. At the same time, reduced SNAP spending in grocery stores and markets means fewer dollars circulating in our local economy, something that affects us all. The hardest hit are those that were already vulnerable, seniors who receive the lowest SNAP benefits amount, children who depend on nutrition for healthy development, families recovering from job loss or medical challenges. These are the people who feel the loss most sharply. For them, every dollar matters. We're trying to step up at Otsego County United Way and many of our nonprofits in the county and in our region, but we simply can't do this alone. We cannot. The dollars are not there. We need assistance. We need help. We need our funding restored for many of the programs that are being cut because the food insecurity, the housing issues, they're all tied together. It's a ripple effect. So when one program gets cut, it strains another. So our other programs and our nonprofits are being strained by that. This is why awareness matters. People need to listen. We need to have collaboration like we're doing now. We need to work together to ensure that no one is left to face hunger, homelessness, insecurities, basic needs. We shouldn't be struggling to feed people in this country. It should be a right that people get to eat. That all matters and it stays right here. The long-term effect is detrimental for our communities. And I really think that everyone on this call, it's all together. It's all of these things are really struggling because of the cuts that have been being made. So I really think that we have to use our voices and we have to use our resources, but we need help.
Thank you so much. Thank you so much, Kim. And I think we'll see that as Kim pointed out, with the stories that we're hearing about income inequality and housing and food, that a lot of these are intertwined and they interact with each other when we look at our district. I'd like now to introduce Dr. John Sanjorzen. He's a retired infectious disease physician who has served Northern Michigan for over 40 years. He's also a fellow of the American College of Physicians to talk about healthcare in our district. And I really want to thank you so much for being on with us.
My pleasure. Thank you for allowing me at the time. I started my career in patient care over 42 years ago. Early on, I learned that the people who suffer most in our healthcare industry are the working poor. That is, hardworking people who don't have adequate or any insurance and make too much to qualify for Medicaid, but don't have the finances to handle healthcare on their own. I've seen too many premature deaths and many bankruptcies as a result of this longstanding structural problem. The previous speaker discussed poverty and ALICE rates in our district, meaning that at least 40% of our citizens are basically struggling to meet their basic needs of food, housing, transportation. So changes in healthcare can dramatically alter their futures. And those numbers are 2023 data. I don't know about every place else, but here where I live, housing prices have doubled in the last 3 to 5 years. So I suspect these numbers are worse. These pre-existing problems are now compounded by recently enacted and impending cuts to Medicaid and the NIH. We have quasi-qualified leaders in the NIH who've compounded the budget cuts with changes that aren't backed by science. Life-changing basic research has been gutted, and our brightest young research minds are leaving for other countries to further their research careers. People with real institutional and specialty expertise have either been forced into retirement or left due to exasperation with their leadership. As a result of all these things, more people will be pushed off Medicaid. More people will be foregoing vaccinations, leading to outbreaks of previously eradicated diseases. More people are without access to preventative services, which will lead to more advanced states of disease and rising costs for us all. Now, these are areas where a vital public health service could help pick up the slack and provide some of these services. But the public health service has also seen deep budget cuts, and they're struggling to meet their basic tenets. And at the same time, leaders within the public health service their voices have been silenced. This is going to take a huge personal toll on all the residents of Michigan's 1st District. A large portion of Michigan 1 is rural. Hospitals in rural areas already face a relatively high burden of uninsured, underinsured, and Medicaid patients. All patients in all of these categories already strain their operating budgets. With more people losing insurance, more rural hospitals may be forced to cut their services or close their facilities. Our citizens already face challenges with access to care, and they're going to be up against even higher barriers. This is somewhat weird because the number one employer in this district falls into the category of healthcare and social assistance. And the number 2 employer in the area is retail and trade. So when you lose healthcare cuts, when you lose bodies and incomes in the healthcare industry, they have less money to spend, which then you hit both the number 1 and the number 2 largest employers in our area. It's easy to see how that will be quickly compounded. A vital healthy healthcare industry is critically important to this district. I'd be wrong in saying that providing basic healthcare to citizens isn't expensive. It is, but not providing these services also carries enormous personal and societal costs that we cannot allow to happen. Thank you for your time.
Thank you. Thank you so much. I really want to thank all of our guests who've come on to show us the need in the district. And I just want to note that these are highly qualified people, caring people, often doing everything they can with what little they have, and we're lucky to have them. We're living through the worst income inequality in modern history. This has been fueled by billionaires and corporations who use their wealth to shape government and its laws so it serves the richest and not the rest. And America, at its founding, it promises everyone a fair shot at life, liberty, the pursuit of happiness. And I think a lot about what's in a life. And that's my platform that I'm talking about today. What's in a life? I'm using it as an acronym. It's local housing, like we heard from Ashley. It's income, real income, wages you can live off of, like we heard from Adam. It's food, like we heard from Kim, and it's essential healthcare, like we heard from John. This platform is not earth-shattering, but I think that's the point. These are the basic necessities of life, and government isn't working for us right now. These current funding cuts are devastating. And when people can't access the basic building blocks, we're failing on both our founding promises and the idea of a truly representative democracy. So what I'm saying is it's time to fight for an affordable life. And this fight isn't just about economics. It's about restoring people's voice in government. And that also strengthens our democracy. So I'm happy to talk about any part of my LIFE. And of course, we have folks here still on who can answer questions about what they see in the district or what that need is. but what I also would like to say is that this is not about me. It's about us. Kim, I think you said this eloquently, that we're working together. And I think at the end of the day, it doesn't matter what your politics are. The need is great, and we got to come together to meet it.